Hi everybody, welcome back to my channel. I'm Yesha if you're new here, and I know everyone is getting geared up for residency. People are starting radiology, people are starting internal medicine or prelim or whatever it is, and I wanted to make a few videos about like the whole transition, but I think today I'm going to make a video, it's more general, just to kick things off, about what it means to be a good resident. Now this is going to be from one resident to another. I'm not a program director, I'm not an attending, so I'm not going to be like, oh well, you know, these are the golden rules to being a good resident, but I'm going to tell you my experience, having worked with lots of different personality types, lots of different people, and what I think makes someone a good resident. So I hope you enjoyed this video, and let me know what you think. Okay, so I just wanted to start off with something really simple. I think everyone can achieve this. Be punctual. It's not that hard. I really feel like this is a respect issue. This is also something that has been ingrained into my mind since I was like 3 years old. Be on time. I come from a family that is not like all of the other Indian families. Like, we are always on time, and we're often the only family at a party at 6:30 p.m. and everyone else shows up at like 8. But that really has carried over into my residency, and I really value that in other people. If something starts at 7:30, I really feel like it's disrespectful to not be there at 7:30. We often, you know, like if something is really supposed to start at 7:30, you should be there and be ready to go in my mind. So for me, that's really important. That goes for really anything, and I think like for rounding, if you're expected to start rounding, like be there, be on time. It just makes a good first impression, and I know that attendings really value it too. So yeah, be on time. That goes for any specialty, it goes for anyone, and it goes for any aspect of your life. Just be on time. The second tip is understanding the value of teamwork. Now, being chief, I really understand the value of teamwork because there are times when we have to call upon people to help us. We have an unexpected conference that needs to be presented. There are so many things so many times when things come up, and realizing that you're part of a bigger team is so important. For example, if, sometimes some patients or some studies just take longer than you realize. Some patients are sicker than you realize. And if one of your co-residents has 3 really sick patients and you have, relatively a lighter burden, offer to help them with stuff. Those little things really go a long way. And guess what? You're going to be in the position of needing something from someone, and you want to be seen as someone that always helps out. And if you're that person, people are going to be really willing to help you out when you need it too. And that's so important. Residency is a team sport. You really need each other to get through it. You're going to need each other to cover shifts. You're going to need each other for a million reasons. And I think that being the person that helps out, really, it looks good on you, and it will go a long way for you. So be the person that helps out. Be that person. Realize that it's not just you, it's a team. Instead of you leaving at 1 p.m. and everyone else having to stay and work until 5, maybe you can help them, call a consult, do something, put in the orders. That was something that my seniors did when I was an intern. That was so awesome. They put in the orders as we were going, and I mean, we still had to write the notes, but like, that was a huge help. And I think that it's just all about teamwork. So if you're a senior, find a way to help your interns, offer to write a note here or there. It's really nice, even when something so simple can just be taken off of your burden. It feels really great. So understand that everything is a team sport. I mean, medicine is a team sport, and yeah, you're part of a bigger team. It's not just you, it's everyone. So I think that's really important, and that really will go a long way to being a good resident. The third thing that I want to talk about is just reading every single day. If you go home and read for like even 30 minutes on a topic, you're gonna go back and be a better resident. You're no longer studying for a board exam. That's the difference between residency and medical school. Is like, now you have to know things that you can take care of patients. It's not just to pass your boards. And I think that really changed my mindset a lot, actually. And so yeah, go home, read the up-to-date on, COPD, whatever it is that your patient has, and just be the expert in it the next day. Just be like, yes, I read this paper. And even if you just read one paper, that will make you so much smarter. And if you're an intern who's going into radiology, for example, those things really help you out as a radiology resident as well. I really feel like the number of times that, you know, a team will ask me, well, instead of a chest CT, then like, what should I do? You can actually offer advice to the team because you actually know how to take care of these patients. You're not just someone reading imaging, you're also a physician. So being able to offer that, being knowledgeable in that will go a really long way. And then of course, if you are in internal medicine, then you do need to know those things anyways. So read every single day, and it will impress your attendings when they ask you questions that you already know answers to, and it will help you in the long run because you will have to study less for your boards. You will already know a lot of the things that they're going to ask you about. And yeah, I just think that reading is never wasted. Whether you learned something, whether you just gleaned a couple of new things from the same article that you've already read, just read a little every day. It's really, really important. The next thing I want to talk about is just being reliable and being trustworthy. And that goes for like little things. Obviously big things like patient care, obviously that should go without saying. Like you should be a very good physician. But aside from that, little things, like if I ask you to do something, or if someone asks you to do something, like I don't want to have to worry about it getting done. And that is definitely something that I think separates different types of residents, because there are definitely the type of people who will say they'll do something and they don't. And then there are people that will do something and then, or say they will do something and then they get it done right away. And I try to be someone who gets things done right away. I try to be very reliable. If someone asks me to do something, I really try to get it done, because I would hate to be someone who has to chase me around, right? I don't want to chase someone around to get something done. So be reliable, be dependable. If your attending tells you to call a consult, do the consult, because you don't want them to find out later that you didn't do it and then something slips through the cracks, etc. It's just poor form. So be reliable, be the doer, get things done. I think that will earn you a lot of respect in medicine. The last thing I want to talk about is maybe more of a problem now, because we all have access to cell phones and iPads and we're always on these devices. But my last piece of advice is to just be present. Be in the moment with what you're doing. If you're rounding, don't be on your phone. It's easy to get distracted when a different patient is being presented. It's not your patient. You don't have anything to do with that patient. But what did I say earlier? Radiology, or not radiology, it is, but medicine is a team sport. So if you're paying attention, you can offer answers that maybe you know the answers to that someone else doesn't. If there's a question that comes up, maybe you know the answer. But if you're not paying attention, you're not going to be able to, you know, chime in. And that gets really important when rounds start to get really long, or it's kind of later in the day and people are texting you, people are doing all, like, you know, we are just so surrounded by our devices all the time that it can be really easy to get distracted. So be present. If someone is giving a 15-minute talk, like a whiteboard talk, just listen, pay attention. You'll learn something, and you'll be able to, like, you know, take that concept into the next patient that you take care of. I think it's really something that we're losing in medicine, or I don't know what it is. Like, I think it's just all these devices. But yeah, just be present, be in the moment, know what's going on with all the patients that are on your team. Because, I mean, if you've been an intern, you know that come the weekend, you're gonna be taking care of all the patients. If you're on call or working the night, you're taking care of all the patients. So it's good to at least have some idea of what's going on. And that goes in radiology too. We're constantly learning, we're constantly seeing, you know, different types of things, zebras, we're seeing crazy stuff, and we're seeing every patient. And so paying attention, you're just gonna learn so much more. You're gonna absorb so much more and take so much more away from your residency than you otherwise would have if you were not in that moment. So remember, medicine is a team sport. I've said it like 3 times now. Being there in the moment, having a great attitude, and being dependable. I think those are really, to me, what would make, and being on time, okay? That to me is the makings of a great resident right there. It's all stuff that is achievable by anyone. You don't need to be a genius to be a good resident. You don't need to be the brightest, the fastest, the anything. But you have to be a hard worker, and you have to be willing to put in the work. You have to be willing to put in the time. That's what residency is about. And so I hope this video was helpful. And I hope this, maybe if you felt like you were not someone who's going to be an amazing resident, I hope that you realize that you can be an amazing resident. It's really not about being like the brightest, the most brilliant, who knows the gold criteria off the top of their head. But it's someone who says, I don't know that, I will learn it, and then they come back and they know it, you know, the next time. So to me, that's that's the best type of resident, and I think a lot of people would agree with me. So in any case, hopefully this was a good first kind of intro into residency and intro into residency videos, I should say. And I will see you all in the next one. Bye.